Hello, ladies and gentlemen. Welcome to Triple N Media. I am Dr. Nik Nikam, a cardiologist from Houston, Texas. The feature presentation is too much of good cholesterol, the HDL, bad for your health? We're always told that HDL is the good cholesterol. The more you have, the better it is. But however, having too much of it could be having a different effect on your body, and we're going to look at that. So that is going to be the feature presentation. But before we go into the HDL levels, which is low, normal, high, and what are the effects and what we can expect, let's study about cholesterol 101. As we know, the body takes all these fatty acids from the diet, converts them into HDL, and that HDL is the good cholesterol, which removes these plaques from the arterial walls, or it takes out the LDL, the bad cholesterol, from the arterial plaques, and it returns it to the liver for metabolism. The HDL is a good cholesterol. It is a high density lipoprotein, and it is the HDL that protects you from getting significant coronary artery disease. The HDL level, if it's less than 40, it is considered to be low. The normal range is between 40 and 60 milligram per deciliter, that's 100 ml, and it's considered high if it's more than 60 or 80 milligrams per deciliter. So that is the normal expected range. The LDL, the normal range should be less than 130 milligram percent. But if somebody has heart disease, diabetes, and multiple risk factors, now we as a cardiologist recommend the LDL to be below like 70 to 80 milligram per deciliter. So that's a different topic altogether. So let's get back to HDL. The Journal of the American Medical Association on March 18th published an article showing the association between high density lipoprotein cholesterol levels and adverse cardiovascular outcomes. That's kind of a oxymoron. We thought the HDL cholesterol was supposed to have good cardiovascular outcomes, but here this article looked at different levels of cholesterol and what effect they had on cardiovascular morbidity and mortality. We know if the HDL cholesterol is below 40, it has an increased risk of heart disease. And between the ranges 40 to 60, that is supposed to be the acceptable range. There were hardly many studies showing if we had too much cholesterol, because we have seen patients with HDL levels of 80 or 100 milligram percent, and we always said, oh, if you have 100 milligrams of HDL per deciliter, I think that's great. I don't think you should be worried about heart disease and all these things, but those things are things that we used to say in the past. But based on this article, we're going to look at a whole different aspect of the high levels of HDL and associated morbidity and mortalities. In order to look at this, a multicenter study in the United States and in UK was performed between 2006 and 2022. There were 14,478 patients with a mean age of 62 years. They were followed for 8.9 years. So this is a pretty long-term study looking at their baseline cholesterol levels, especially the HDL level, and categorizing them into below normal, normal, which is 40 to 60, and above 80, which is high. Interestingly enough, here are the results of this fascinating long-term study of the effect of cholesterol level and cardiovascular morbidity and mortality. They took the population which was in having a HDL cholesterol between 40 and 60, and their risk was adjusted to be 1. In other words, if their risk was 1, the all-cause mortality in the group which had HDL level greater than 80 was 1.96. That's the hazard ratio. That means there were almost 2 all-cause mortality deaths, all-cause mortality in the HDL group, which was greater than 80, compared to the normal HDL group between 40 and 60 milligram per deciliter. And this was statistically significant. And when they looked at cardiovascular deaths, this is what we talk about. The higher the HDL level, the better it is. You have less incidence of cardiovascular problems. But however, if the HDL level was greater than 80, the cardiovascular deaths were almost 1.71%. That means it is like if there were 100 people dying in the normal range group, there would be 170. So there's a 70% increase in the risk of dying with cardiovascular problems if the HDL level was greater than 80 milligram per deciliter, and this was statistically significant also. And when they looked at this same data and separated men from women, the data became much more evident that in men, the risk of having higher cardiovascular morbidity and mortality in the HDL group, which was greater than 80 milligram per deciliter. So if your HDL level, if it was a male patient, if the HDL level was between 40 and 60, and if the risk was 1, whereas in male patients with the HDL level greater than 80, the risk was 2.63 times that of the normal population. So this is highly significant. But they didn't find the similarity in the women's group because the hazard ratio was 1.39. That means it was a 39% increase in the deaths among women, but that was not significant compared to men, where the death rate was almost like 2.5 times higher than the population with 40 to 60 milligram per deciliter. So ladies and gentlemen, there you have it. If you have less than 40, you have increased risk of cardiovascular disease. If you have more than 80, you still have increased risk of cardiovascular disease. How do you bring down the HDL level? There are not many things that you can do to bring down the HDL level except using drugs like statins, which can bring down the HDL level to a certain degree. But more importantly, we need to focus on the other group, that is those patients who are having HDL level below 40, who are at a highly increased risk of cardiovascular problems. So let us look at the group which has less than 40 milligram per deciliter HDL level and what we can do about that. Uncontrolled diabetes, smoking, lack of physical activity, excess weight, genetics, stress, poor eating habits, they all can lead to low levels of HDL cholesterol. So here is an opportunity for us to improve our HDL level by increasing our exercise, getting the weight under control, getting the blood sugar under control, smoking cessation, and of course drugs like statins, phenofibrates, niacin, and alcohol increase the HDL, but they are not the conventional ways in which you want to increase the HDL, especially like alcohol. It raises not the good kind of the HDL that you want. Niacin has flushing and side effects which not many people would be able to tolerate. And of course the LDL, which is the bad cholesterol, which is the one which is talked about all the time. The way to lower the cholesterol would be, of course, with the statins, fat reduction, and of course weight loss, diet modification, blood sugar control, along with nitrates and niacin and fibrates. So ladies and gentlemen, this is a quick overview of what the HDL or the good cholesterol means, what level it should be, and what are the risks if it's low, and what are the risks if it's too high. I hope this has been educational to you, and please do subscribe to our YouTube channel. I will see you in the next presentation.